Hi everyone, this is Dr. Konstantin. I'm a facial plastic surgeon and a facelift expert. And today we're talking about facelift, of course, in particular a male facelift. And I want to walk you through the aging changes and the decision-making process. How do we decide what kind of facelift and what type of procedure is actually good for somebody? So let's take a look at before pictures. The biggest complaint that this patient has was the sagging. So all that extra skin under the chin, the jowls, and the hollow cheeks, that was something that he felt is aging him greatly, and I fully agree with this. So first thing we do when we look at the patient, we look at the neck, and we have to decide whether there is some extra fat here. If there is some fullness there that needs to be reduced, then of course we need to do a liposuction. Now, in addition to liposuction, if somebody's neck is very heavy and we see those bands here running in the middle, like you see with this patient, we would need to do a procedure called a platysmoplasty. And platysmoplasty, of course, is the removal of those muscle bands and tightening the contour under the chin. So once the neck is tightened, we're going to be lifting the jowls and we're going to be removing all that extra skin in the neck by pulling it backwards. But before we do the lifting, we have to decide what type of a facelift we're going to do. And the decision that we make is usually based on whether we need to do cheek elevation or just tightening of the jowls. Because if we just tighten the jowls in a patient who has saggy cheek, that would not look very natural. And the combination of a tight jawline and a saggy cheek just looks like something that would give away the fact that somebody had a facelift. So in this particular situation, because the cheeks look hollow, we decided to do a deep plane facelift, which is the best procedure to rejuvenate the entire face starting from this point down. So taking care of the jowls, smoothing out the cheeks, restoring the jawline, and just improving the lines and the skin laxity around the mouth. Deep plane facelift is the procedure that would accomplish all those changes and all those goals for somebody's facial rejuvenation. Now, in particular, looking at the male face, a lot of male patients are concerned that if they get a facelift, they're going to look more feminine. But in fact, and you're welcome to take a close look at the picture and tell me your opinion in the comments, the male patients, after getting a lift, after getting rid of those jowls that completely change the contour of the lower face and obstruct the jawline, this patient looks more masculine after getting a facelift than they looked before. So just restoring that nice angle and a nice uninterrupted smooth jawline makes somebody look more energetic, healthier, and more masculine, at least in my opinion. So those are the before and after pictures for you, and you can see what difference we can make by doing a neck and a face rejuvenating procedure on a male patient.